Okay, all right. Hello everyone online and hello everyone in the room. I am Gwen Driscoll. I am the Director of Communications here at the UCLA Center for Health Policy Research. Welcoming you once again to our 2017 Health Policy Seminar Series. It's August and we have a true summertime topic for you today, an innovative program to make previously underserved Los Angeles parks safe, fun, and healthy places for the entire community. But as always, let me talk about next month. Our next seminar will be on September 27th. Los Angeles has the lowest enrollment rate of consumers in MediConnect, a program that is responsible for the delivery and coordination of the medical, behavioral health, and long-term services and supports benefits for those that are duly eligible for both Medi-Cal and Medicare. In this September 27th seminar, Center Research Scientist Catherine Keatsman will describe the factors that may be contributing to this low enrollment rate. Catherine has been conducting qualitative studies with dual eligibles, both one-on-one interviews and focus groups, as part of her CHOICE project, which stands for the Center's Consumer Healthcare Options, Investigating MediConnect Enrollment, which is, there are now several publications on the enrollment process and some of the challenges it's facing in California and now with this seminar in Los Angeles specifically. She will describe the unique challenges of getting these most vulnerable consumers signed up for a program in a county of widespread diversity and languages, in a program that offers 5 different plan options, and among a group that is fiercely devoted to their existing network of care. Again, that's September 27th at noon. Please join us. Okay, as for today, we will be recording the seminar and it will be available on our website very soon, within the next day or so, at the link you see at the top. Just look for Center Videos. If you're watching online and you'd like a copy of today's slides, please email me at gdriscoll@ucla.edu. Please also note we will have a brief Q&A session at the end of this that I will moderate. Okay. Parks After Dark is a Los Angeles County program that began in 2010 as an effort to reduce gang violence and other at-risk behaviors in communities with higher rates of violence, economic hardship, and obesity prevalence. The center was the evaluator of this innovative program, in which select parks stayed open late on Thursday, Friday, and Saturday evenings in the summer months to offer a variety of safe, free, recreational, and cultural activities for people of all ages. What started as a program in 3 parks has now been implemented at 21 throughout Los Angeles County. In today's seminar, lead evaluator Nadereh Pourat, director of the center's Health, Economics, and Evaluation Research Program, and senior research associate Anna Martinez will describe how the Parks After Dark program evolved into a key county strategy to promote health, safety, equity, and community well-being. We also want to welcome the project officer for this evaluation project, Kelly Fisher of Los Angeles County Department of Public Health. Kelly? Hi, Kelly. Okay. And the Parks After Dark coordinator at the LA County Department of Parks and Recreation, Nadereh Pourat. Thank you for coming. As I said, Nadia is the director of the center's Health, Economics, and Evaluation Research Program, which is widely known in California and nationally for its ability to evaluate the costs and benefits of numerous large-scale public health initiatives. She's also the center's director of research and a professor in the Department of Health Policy and Management at the UCLA Fielding School of Public Health. Anna is the project director for the Parks After Dark evaluation and a graduate of the Fielding School's MPH program. They have spent a lot of time on this project, and the results of which are summarized in an evaluation brief that's available on the center's website right now, www.healthpolicy.ucla.edu, and presents in a very unique visual format some of the evaluation's key findings. Without further ado, let me welcome Nadereh Pourat and Anna Martinez.
Thank you, Gwen, for the introduction. Thanks, everyone, for attending this seminar. We are doing this at a slightly different time than our usual, so we're happy to have you all here. I will spend a little bit of time talking about the program and a little bit of the evaluation. Now I'll trade places with Anna, who will sort of describe some of the other aspects of the program, and then I'll come back and wrap it up. So we're going to talk about the program that Gwen briefly described, Parks After Dark. Parks After Dark is an example of a place-based public health intervention that is designed to address social determinants of health. In other words, it's designed to address some of the contextual factors that determine health status at the community level and contribute to health problems and health inequities. For example, issues of safety, which are important, particularly as the impact of factors such as direct and indirect impacts of factors such as crime on the population in terms of the direct harm or the unsafe places where people do not have the ability to exercise and live. There are also other economic hardship issues in a lot of places around the county, or in general, that reduce the ability of individuals to participate in healthful activities. So Parks After Dark is, as you heard briefly, a Los Angeles County program, began in 2010, and originally it was targeting the gang violence. It was a gang violence prevention strategy, but then expanded into additional goals, including targeting promotion of healthy behaviors in the communities. And the program over time has expanded. In 2016, there were 21 parks participating, and I believe in 2017, 2 more parks were added. So the program is currently expanding and likely to change in additional ways over time. A key county strategy to promote health, safety, equity, and community well-being, as you heard, and a collaboration of multiple county departments and community partners, which is also quite a unique aspect of the program. This is not just a Department of Health, public health, or a county parks and recreation activity, but there are multiple departments that participate, and you'll hear more about that a little bit more. PAD provides free sports opportunities, entertainment, and a whole lot of other services during summer evenings, 3 nights a week, expanded hours. And we'll provide some additional information about those activities, but most of the Parks After Dark is focusing on the unincorporated areas of Los Angeles County and the parks that are located in those areas. There are other, by the way, programs in LA County. LA City, for example, has a program. And there are some cities, such as City of Pasadena, that also implement the Parks After Dark program. So there are other efforts sort of targeting the same issues that Parks After Dark is addressing. So this is a unique program that's also building on this collective effort in terms of public health interventions targeting these kinds of activities. Here are the parks that participate in PAD, and as you can see, the program has grown tremendously. In 2016, a whole number of parks were added to the program and expanded these services to a lot of different areas in LA County. We'll talk about the goals of the program. There are 6 goals that were goals of the program and also goals of the evaluation. So we attempted to address all 6 of these: increasing access to quality recreational programming and innovative services, increasing collaboration among different stakeholders, decreasing community violence and increasing perception of safety, increasing physical activity, and decrease in risk of chronic disease, increasing social cohesion and community well-being in the targeted communities, and cost savings. These are significant goals, a lot to undertake by this program. So I think that's worth sort of focusing on how much the program was hoping to achieve, and we can report on what we have found on the achievements of the program. The evaluation of place-based interventions are challenging. They are challenging because there are a series of complex dynamics between social and economic factors that determine and impact health. And so to do these kind of evaluations, you certainly have to do mixed methods. You need qualitative information and you need quantitative information. And you need to look at many, many different types of data to be able to assess the impact of the program. And so we used multiple different types of data. One thing that is not on this list that you're looking at is the administrative data that was provided by the Department of Parks and Recreation and a lot of other departments that worked with us to provide data to evaluate the impact of the program. We did, PAD includes a survey of participants in each one of the parks, so it was representative of each one of the parks that participated, with a lot of people responding to a series of questions about how they felt about the program and what activities they participated in. There were key informant surveys, interviews. We did focus groups with the individuals that were involved in running the program and implementing the program at parks, sheriff's department, and some of the county departments. We used the crime data from the LA County Sheriff's Department. We also used a little bit of data from the LA City Police Department. There was a model that we used to assess the impact of PAD on health called IDEM, and we also had a lot of data from the other indicators of health and safety. There were challenges, limitations to the data that we had available, and we have used the methods as best as possible to deal with the challenges of this type of data and these kinds of place-based interventions. I invite you to look at the report, which I believe also is going up online and has a lot of detail about how the evaluation was completed and a lot of detail, additional information that we don't have time to go over today. So I'll talk a little bit about goal one. This was the increasing access to programs and services at parks and providing a glimpse of what was the attendance like and how, what people thought about the services that were available to them. As you can see in this map, there was, this is a list of all of the individuals. It was based on a list of all the individuals' zip codes that were reported, that people that participated in the program. So as you can see, the program actually reached a lot of different zip codes in LA County, primarily focused on the areas surrounding the parks as intended. It was, the programs were for the residents of those communities primarily, but it was very interesting to see how people from a lot of different areas came over. For example, you can see the supervisorial district number 5, which is on top of the map. I don't know if you can see it here, but this is the area. And you can see that there are people coming. It's a very large area, and people were coming from lots of different neighborhoods to participate in the PAD, which was in about 3 parks in that entire district. The administrative data showed that there were 178,000 individuals that participated, and we could see that about 68% of the people that actually participated were from the areas surrounding the parks, and about 32% came from other areas. We have information about the demographics of the participants, self-reported, of course. We had reached a lot of individuals of young ages. 0 to 16 age group was relatively well represented. A lot of people between the ages of 22 to 39, and some individuals in the higher age groups, and some other young adults, 17 to 21. We had quite a diverse breakup of the racial ethnic groups that participated. A lot of the population was Latino, as also the function of the population distribution in the county. And we also looked at the income of the individuals, and as you can see, a lot of people are reporting very low income levels. Just to put it in perspective, we're talking about 2016, the federal poverty level for a family of 4 at 138% of poverty was about 35,000. So you could see that PAD is really reaching its target audience, because part of the reason for locating PAD in these geographic areas was to target the areas with lower economic gains. Asking individuals to tell us how they felt about the program, we had, as you can see, the majority of the population giving it a very high grade. They had a choice of A, B, C, and D, and most people said they really liked the type of activities that were offered, the hours of the activities were great, and that the park facilities were in good shape and suitable for the activities. The an additional 22 to 25% also gave it a B. So the overall grade point average, if you will, was about 3.6. So most people were very happy with the activities in the program overall. 94% said they would attend again, and another 94% said they would recommend it to a friend. So there was pretty well consistent information from the participants that they liked the program and the services. A lot of people were really interested in arts, entertainment, and also sports. Those were the kind of activities that were very popular with the attending population. And they requested them also. In terms of sports activities, for example, soccer and swimming, they're very popular. And movie nights and concerts were also very popular activities. We asked similar questions from the key informants in terms of what they considered to be successful activities in the program. And as you can see, there were 36 that responded to these questions, and of these individuals, they all were talking about the fact that the program actually really is reaching the intended population in the type of services that they need, the kind of activities that they are interested in, and the community needs. They thought that the environment was pleasant and welcoming. It made it easier to outreach to these hard-to-reach populations. So you really, in order to understand the impact of the program, really need to get deeper into what are the characteristics of the communities that these parks are located in, the level of economic hardship or other factors day-to-day that these individuals have to live with. And that sort of brings it home to why these kinds of topics that come up throughout, the themes that come out in the evaluation, are so relevant. And PAD provided also opportunities for community members to learn about county services available to them, which is also another goal of the department, to sort of make sure that these kinds of services are well known and well used. A little bit more about what the key informants thought were successes and challenges for the program. In terms of successes, ensuring safety during the PAD programming was obviously a very important success from the perspective of people who actually run these parks. You'll see a little bit more about the characteristics of the key informants, but a lot of the key informants were people that are from the Department of Parks and Recreation. These are individuals that run these programs, so they understand what the needs of the communities are. They also were talking about providing the diverse activities that are tailored to community needs, so that you can identify what the needs in the community are, and also try to organize programs that address those needs. Building collaboration obviously was also one of the things that the key informants were very happy about, because the program offered this opportunity to work with people from lots of different parts of the county that may not have had opportunities to work together before. In terms of the challenges, providing adequate staffing to plan and implement the program. Obviously, this is an extensive program, requires a lot of resources. So getting all of those resources together in a timely manner is a challenge that they have to always work with. Identifying and securing a consistent source of funding so that there's always an assured source with a specific amount, and ahead of time what you're working with. And then the challenge of marketing PAD to a variety of community members. Each one of the parks took different approaches in how to market it, and so you'll hear a little bit more about that as well as we go through. So I'd like to now hand this over to Anna, who's going to talk about the other evaluation goals.
Thank you. So the second goal of PAD was explicitly to improve the collaboration in order to provide innovative services. And so PAD has really evolved in terms of who the partners are, but at the heart of it has always been the Department of Parks and Rec, because they're physically hosting PAD. And then the Sheriff's Department has been integral to PAD. There's a specific department that has officers responsible for parks. And so the Sheriff's Department will do their best to make sure that the same sheriffs are at PAD week after week. And so people can really start to build that collaboration, both with the park staff and to have relationships with the community. And then the County of Los Angeles has a few different offices that have been integrally involved, including the CEO's office and the Office of Child Protection. And probation has always been a partner, but has really become much more of a stakeholder in 2016, providing some of the funding that allowed PAD to expand. So Nadi talked about how in the last year there have been so many parks added, and that was really with a lot of thanks to the probation department. And there have been many community partners. Parks and Rec has been very active in terms of involving people in the community who can bring resources to the park. For example, the local library and certain businesses or other kinds of sports teams that might be able to come and be a part of it. And finally, the Department of Public Health has supported this evaluation, but has also done activities like the walking clubs so that people can have more access to the physical activities. So we spoke with key informants from those organizations primarily about how they felt cross-sector collaboration had changed as a result of PAD. And so first of all is PAD, 33 out of 36 people said that PAD improved the relationships between county departments and between community members, and then also that it had improved collaboration between other departments. And the two departments where we saw the highest level of collaboration was with Parks and Rec and the Sheriff's Department, because those are the people who are on the ground every time that PAD happens. And so they're really working most closely together. And then the last item is that through PAD, I worked with new groups or departments that I had not previously worked on. And we actually found it interesting that 4 people said that the answer was no. And the reason for that is because those people had already been collaborating. And so what we're seeing here is that PAD really increased the collaboration among departments that hadn't already been working together, but that there's also many people who were previously working together. And so we spoke with them, and here's some quotes from the informants. So we learned what each department was capable of providing and how each provided their services. We then figured out ways to tie everything together to provide these services to the community. And also, the county family has helped to sustain PAD. The Department of Public Health, probation, CEO, sheriff, and others have stepped forward to support and provided grants, leadership, and resources to PAD. And so we really see a lot of support from the people who are involved with putting on the activities. And as a part of that, we also spoke with people about expansion. And so, as Nadi had mentioned, there was a big expansion in 2016. And so what we saw is very, very high support for expanding PAD to more parks, especially among the probation department and the Department of Public Health. And we saw just a little bit lower level of support for expansion among the Department of Parks and Rec and LA Sheriff's Department. And that was mainly because they felt like they needed more staff to be able to support those services. And so it wasn't so much that they weren't interested in expansion, but that they needed the time and the resources to be able to make that happen. And so one of the key elements of PAD is a resource fair. And on the, on what would be your left-hand side, we looked at the surveys of PAD participants, and we asked them about their current use of services and they're interested in services. And what we found is that about more than a third of people were currently using the services that we're describing here, and that a fair number of people were also interested in using those services even though they may not have already been using them. And I want to give you some specifics about what we mean when we talk about these services. So the way that the resource fair operates is it is a venue for people to become connected with community resources and community services. And so the most common type of service that was provided at the resource fair is health services. And that would include entities like Planned Parenthood and the Department of Mental Health. And then we also have social services such as Head Start and programs targeting seniors, and assistance programs such as SNAP, which is food, like, yes. And the other ones are libraries, and so that would be both the county libraries sending people, but libraries also would try to send people on multiple occasions, so not just at the resource fair. They would try to be present as much as possible. And also public health, which we had discussed earlier. So that would include both some of the more typical public health services that you may think of, like vaccination and those kinds of topics, but also the walking clubs. So that would be something that would be recurring, not just at the activity fair. And one of the key elements of PAD was to involve youth, because it happens during the summer when school is out. And so this is one of the ways that PAD in particular was trying to connect with young, not necessarily children, but young adults. So 5 PAD parks had on-site probation officers, and that was a prevention strategy to help at-risk youth from becoming negatively involved in the criminal justice system. And so an example of that would be that there's sort of a voluntary probation where youth and their parents would agree to work with a probation officer. And so having this person in the park allowed there to be greater access, and then also perhaps fewer barriers to being able to access those services. And 10 parks had teen clubs, which were led by Parks and Rec staff. And so we invited them to participate in a photo voice project where they were asked to identify some key themes in their neighborhood, such as what parks offer, what PAD offers, and then what things could be changed to help make it a safer, better kind of community cohesion activity. And so we've included those findings in the report, but it's a bit extensive for today. And then the third goal is specifically around community violence and perceptions of safety. So not just that the community has fewer reported crimes, but that people actually feel safer in their communities. And so what we looked at first is looking at the crime rates in PAD communities versus the County of Los Angeles. And the time period that we've looked at is 2004 to 2016. And I want to do some definitions with you. So Part 1 crimes are the serious and the violent crimes. And examples of those are larceny, theft, grand theft auto, and burglary. And Part 2 crimes are nonviolent and low-level offenses. And examples of that would be narcotics, vandalism, and non-aggravated assault. And so when we look at these two, the rate that you're seeing here is per 1,000. And so you can see the PAD parks, which are orange here, overall have higher crime than Los Angeles as a whole county. And the reason for that is that PAD was selected for parks where there was higher crime. And so now we're going to talk about the way that PAD has actually impacted the crime. So the first part is part 1, crime. And we did a comparison with parks that were matched on certain criteria. So this isn't compared to all of LA County, it's compared to parks in neighborhoods that look like PAD parks. And what we found is that, one thing I wanted to mention is that more parks are added over time. And so what you're seeing in the beginning, 2010 was the original parks, and then more parks come in. So you're seeing these represent additional reporting, so we looked at the area specifically right around the park. So it's the park community very close around it. And so what we see is the biggest decrease here is when we added those parks in 2016. And so that's really where we see the biggest impact. So there were small reductions in crime over time, and overall that adds up to this 81. So PAD prevented 81 crimes from occurring, according to this analysis. And then part 2, crimes, we see again that when we add those, the majority of the parks at the end, that's where you see the biggest change. And so overall, PAD prevented 91 crimes from occurring, 91 of the part 2 crimes. And so the second element is not just that fewer crimes are happening, but that people also feel safer in their neighborhoods. And so we found that 38% of people said their neighborhood felt very safe from crime. So that means the remainder did not feel very safe in their neighborhood. But 55% of people said that they felt very safe at PAD. And so people, even if they lived in a neighborhood where they didn't feel safe, of those people who didn't feel safe, 7 out of 10 of them felt safe at PAD. And when we asked people why they felt safe at PAD, one of the common things that came up is both the presence of sheriffs, which we talk about here, but also the presence of other people and the staff and the lights, and just having that park be active and lit well at night. And so when we asked people specifically about how they felt about the number of sheriffs, most people felt it was just right, although some people also wanted more, and some people felt that there were too many, 7%. And of the things that people said, so a smaller number of people said they didn't feel safe at PAD, and the reasons for that is that they noticed people who they didn't know in their neighborhood, and so that's one of those elements where having something occur over the course of a summer really provides an opportunity to improve community cohesion. And so we have some pictures here of the sheriffs really actively in the middle of PAD. And so they said without PAD, deputies would not get out of their patrol cars or communicate and interact with the kids or communities in the same manner. And I have to say, we did interviews with the sheriffs, and one example of someone really going out of their way to make the PAD feel like a welcoming community is that one sheriff actually baked cookies to bring to PAD so that people would be able to have a positive interaction with law enforcement. So the Parks Bureau is really a special group of people who are very invested in having the parks and the community be something that they can have a strong and ongoing relationship. And then goal 4 is about increasing physical activity and reducing the burden of chronic disease. So first we looked at what kind of physical activity would people be doing without PAD. And so what we're showing you here is based on the U.S. Department of Health and Human Services recommendations for how much exercise people should have. And it's higher for kids. So kids are supposed to get 60 minutes a day of physical activity, and adults should get about 30 minutes over 5 days, or just 150 minutes spread throughout the week. And so what we see is a little bit more than half of adults meet those recommendations, and only 14% of youth meet those recommendations without the presence of PAD. And one thing that we did see is that quite a lot of participants are actually at parks frequently, And that's because there are a lot of other ongoing programs at parks. And so people may be visiting a park for another activity, but then find PAD and are able to become incorporated into that and learn about it. And so what we're going to talk about here is the actual physical activity as a result of PAD. And so what we see is the types of activity. And so a lot of these, you'll notice, are sponsored activities where someone is leading it. So it's things like walking club, exercise, swimming if a park has a pool, and team sports, and then other activities involves a wider range of things. But 83% of people participated in physical activity at PAD, and notably, almost the same number of those who did not meet the physical activity recommendations did actually also exercise at PAD. So it's really reaching some of those people who might not be getting their exercise in other parts of their life. And then we did an assessment of the impact of PAD on chronic disease burden. And so when Nadi was talking about the IFM model in the beginning, what we did is we took the intensity of exercise that people were doing and put it into a model that looks at the way that that would impact life expectancy and disability-related. And so what we found is that PAD, for the whole PAD population in 2016, increased life expectancy by 6 years. And it resulted in 6 fewer years of disability. And this is an estimate, based on all the people involved with PAD, but that's a really exciting direction to be seeing. So Nadi will address the slide.
Thanks, Anna. So this is the fifth goal of PAD was increasing social cohesion and community well-being. And here we are presenting data from the PAD participants saying what they did when they were coming to PAD, how many of them actually showed up with their children in attendance, and whether it impacted actually the quality of the time that they spent with their kids, and also how did it impact the broader community cohesion. What I was saying before, when you understand the context of these parks and the opportunities that people have or do not have to do things with their family, for a lot of us living in some safer areas of the city or the county, the idea of going to the park with your kids is a no-brainer. You don't have to consider any other factors. But there are many families in LA County that will not have that opportunity and a safe environment where they can do that. So this was just simply providing that safe environment was a huge benefit to the community, and people reported on that they were able to take advantage of this and attend with their families. 88% said so. And you can see that there are a lot of children that are coming to the park are in the right age ranges that PAD is trying to reach. Nearly everybody said that it increased their ability to spend quality time with their children in the summer, get them away from the computers and games and electronics that kids may be forced to do because they cannot go outside. And then a lot of people agreed that PAD improves the relationship with the neighbors. Anna alluded to the fact that sometimes people may not be comfortable. You don't necessarily know everybody in the community, but to be able to go to a park over and over during the summer, you'll actually make meet new people and build new relationships. And again, this is a part of the evaluation where the availability of these self-reported information, qualitative data on how did it impact people comes into play. And when you look at the evaluation brief, you'll see a lot more of these quotes. And throughout the evaluation, there's a lot of feedback from the community on their perceptions of PAD in terms of, particularly here, in terms of ability to spend quality time. I've never really seen a community pull together the way the adults, teens, and children did here at Jesse Owens Park during the Parks After Dark program. This was a staff at one of the parks reporting on the impact on the community and the cohesion and quality. I want to share with you a little bit about some of this data. This is not looking at the actual impact of PAD. Our goal here was to get a better understanding of the different needs of these communities. And we compared it, in this slide, you're looking at the comparison between the LA County average as well as the parks, PAD parks, reported data, but we also, in the report, you'll see comparisons with another group of parks that have some characteristics somewhat similar to PAD, and where PAD could potentially be expanded to in the future. As you can see here, we're looking at the specialty outpatient mental health service use per 100,000. You can see those rates are, this is in 2015, actually quite a bit higher in the PAD communities, and the LA County average is actually quite a bit lower. We're just looking at a snapshot. You can see there's a bit of seasonality in that data, how there's a little bit of variation in when those rates are high, and PAD sort of falls right in the middle of this time period in the summer. Looking at the rates of obesity for adults and children, you can see that PAD parks also show a higher rate. And sort of indicate the importance of programs like this, where they address these kinds of health issues, ability to exercise particularly. Another assessment of community needs, where we looked at the emergency department visit rates that are for non-fatal assaults. And you can also see higher rates in that particular marker. Looking at unemployment rates, again, PAD parks have a higher rate of unemployment. So there is more work to be done.
In relation to what you just been talking about with a question, do you know how many teens, 13 to 18, attended PAD?
Yeah, so why don't we come back to that question afterwards, and while we'll find the answer. So the goal 6 was cost savings, and the information that we had in cost savings was obviously the amount of budget that was available for the program. You could see here the program budget for 2016 was $2.3 million. It was distributed across all of the parks that were participating in the program, so you have to sort of calculate how much per park we're talking about. We had estimated the impact of PAD on reducing the negative health outcomes that Anna just talked about from the item model. That was calculated at about $510,000 in savings. Again, we said it was about 6 years across the entire population. So this is in relation to that. We also estimated that those crimes that may not have looked like a lot, like the 91 Part 2 crimes or the 81 Part 1 crimes, actually could be very costly to the county to just process, just all of that cost associated with processing all of those crimes that are committed in the county. And our estimates show about 5.8 or 9 million in savings over there. And so the difference between the two is about $4 million in savings. We do have some caveats around these. Obviously, there are estimates, and all of that information is available in the report. I invite you to look at it. We reported all of these dollars in 2016 numbers. So based on all of the data that we have shared with you and is in the evaluation report and the brief, these were the recommendations for the program. So it was very important, obvious, that engaging a diverse group of community members and local organizations is key. There were a lot of different services that can be provided by the local organizations, and engaging those organizations to just sort of expand the breadth of activities that's available at PAD or services that are available at PAD are crucial. And it also builds additional connections between individuals and the community services, sort of goes beyond PAD itself. Using the park as a hub to link the at-risk youth and families to needed services, we shared a little bit of information about the resource fair, and then there were also the other services such as the probation that we talked about that bring in services to the park. Bring in services to the park where people live and play is the main goal, and so bringing it there makes accessibility that much more better. Developing innovative on-site services. Some of the park staff were talking about the innovations that they have come up with, how they figured out to do something that was out of the box, but it really worked for the community was very important. And so we recommend that that kind of innovation is nurtured and continued. Looking at another recommendation is increasing engagement of the deputy sheriffs. What was really effective and important was the fact that sheriffs are on the ground, get out of their cars and walk around and talk to people. You saw some pictures of the cars in the middle of the green spaces. That was so important to show some of those to sort of slow down crime or anybody who's thinking about committing some of those activities, to know that the police are there and they're watching. The sheriff department was talking about bringing in their some of their command center, for example, to the park, taking the youth and walking them through so that they could see what the sheriff does and breaking down some of those barriers between them and us. Providing more physical activity opportunities, probably expanding park perhaps to newer evenings or length of time could provide additional opportunities for people to participate in physical activity. Again, given the income level, joining a gym or something like that could be out of reach for a lot of people, but these classes, a Zumba class that's offered at the park free of charge, is an incredible opportunity, and we recommend that those kind of activities continue at a minimum. And finally, sort of making sure that the funding for the program is secure. There's a lot of effort that has gone into putting resources together to run this program, lots of different sources that have participated and provided funds, but to expand the program and to maintain it requires some level of stability, and that's something that I think needs to continue and be confirmed. This is the evaluation team. We have other members that we have Leanne that spent many hours working on the project. We have other members that worked on some of the other aspects of the evaluation with us. And you can see the evaluation report and the brief here. And I think we can now take the question, perhaps go back to the question that was posed by a number of you. Why don't you come up? Yeah.
So, yes.
So the question is, how many teens between the ages of 13 and 18 or thereabouts attended?
So we did not show the number specifically for that subset, but about 24% of attendees were under the age of 16. And then we also asked about people who attended with youth of other ages, and that one we did break out. But if someone was responding for themselves, then they would not be reflected in that number, if they went with their younger siblings. So we can provide an estimate if the person was interested. Yeah, it's in the report.
Yeah, so there's a lot of detail in the report on attendance and ages and things like that. Mm-hmm.
Another question? Okay, we have a question on one.
Have you explored or considered social impact bond approaches to fun activities? to fund activities, excuse me?
That's an excellent question for our partners here from Kelly. Do you want to address that question?
Sure.
Hi, Kelly Fisher with the Los Angeles County Department of Public Health. I've worked closely with the Department of Parks and Recreation for evaluation strategic planning. And a few years ago, we did explore applying for, I think it was called something else, but something similar to a social impact bond for Parks After Dark. I think particularly given the impact on cost savings around safety and chronic disease, there's a lot of potential to redirect resources from other sectors to support a program like this. So I think it's still something that we would like to explore.
Kelly, maybe you can talk a little bit about the different funding sources that came together to fund the program.
Sure. So originally, PAD started very small. It was part of the county's gang violence reduction initiative, and that was funded through the county budget. When that initiative went away, the Department of Public Health was able to find some funding through our Centers for Disease Control Community Transformation Grant to help it expand to more parks. The Chief Executive Office has also provided ongoing funding, I think based on those 6 parks. There have been a few other funding sources. I can turn it over to Tadevik to speak more about that.
As Dr. Pourat mentioned, probation department has been integral as far as expanding programming and providing the funding that was necessary. And as Kelly mentioned, CEO from the beginning has provided a consistent funding source. And we feel confident now with this evaluation data that we'll be able to apply for more grant funding because we have the data to support what we've always known, and that this is a wonderful program that brings so many benefits to our community.
Is there any estimate about the participation rate by day? Because you have a Thursday, Friday, and a Saturday, and I assume Saturday the participation rate could be highest.
That's a good question. So the question is whether we know what days where attendance was highest. We don't have that data broken out by day particularly, but it was interesting, I think, in some of the key informant interviews and focus groups, people were talking about Saturdays actually are not necessarily the highest attendance because it competes with other family activities that individuals have. So they actually found that the Thursdays and Fridays were quite high in terms of participation. And also it depends on what else is going on elsewhere. For example, some of the parks, if you look at the map, some of the parks were kind of close to each other, and sometimes an activity might be happening at a nearby park that might attract a lot of visitors. And so, you know, it sort of depends on what else is going on.
Okay. Do you know if anything was done, and maybe this is a question for the county, about safe corridors or safe pathways to the parks, much along the lines of safe pathways to school to get people safely to the parks and back?
Actually, we don't have information about that, but I can tell you a lot of these parks are right at the heart of those communities. So we have visited, last year we visited several of these parks, and I think a lot of them are very right in the community, and I think that you visited some of the parks too. So I don't know whether it was particularly an issue for the people that were within that community, but we don't have data about whether there were challenges to get to the park. That's a good question.
Another question
Laura Geisha, Community Liaison Public Health Nurse. I have been honored to be able to promote the Community Walking Club for the last 8 summers in the one of the major parks. Well, I'm saying major because there's a lot of community attending that park, Franklin Roosevelt Park. And I've heard input from the community as to the safety at the end of the evening when they're going back home. Have given personally myself a small ride to their homes because it's only like 5-6 blocks. It's out of my my working hours, but yeah, that would be wonderful to have some help for some of these participants that don't have transportation because they love to join the park after dark activities. And regarding the prior question, the most attended evenings, this park is the music, the concerts. They love the concerts, and I keep getting feedback from the community about what they love to come on Thursday evenings because that's the evening of the concert night over there.
Thank you.
Okay, we have an online question. How easy was it to get the law enforcement data?
Sure. So we primarily use data from the Sheriff's Department because most of the parks are monitored by the sheriff, but there are 2 parks where we needed to use data from LAPD, and that was a little bit more intensive, but we actually had quite a bit of support from public health, so that really facilitated the evaluation.
So this data is actually available publicly online, the Sheriff Department data, so we were able to download it, right? We were using confidential information. Yeah, so it's not difficult for the public to access that data. It's just there's a bit of a lag time in getting the data, and it could be very specific. The challenges with the Sheriff Department or the LAPD data is the way that the data are available and the location information may not always match exactly what you need. So you get the data for an entire reporting district, which may or may not match the park's area. And so there are some challenges of using that data, but the data is publicly available.
Just on that note, I wondered, is this evaluation process going to continue, or is it contingent on funding? So, is there a plan to look at the impact to crime rates long term?
Well, thank you for the question. Yeah, so we are actually going to continue this for 1 more year. For 2017, we're also going to evaluate. Part of the goal of this evaluation was not to continue evaluating externally, but to develop the capacity within the county to continue doing the self-evaluation of the program and sort of provide a lot of these methodology and we did a really comprehensive evaluation in 2016. Next is going to be a more restricted evaluation because a lot of factors we looked at. We looked at a lot of data over time already. So we didn't necessarily present all of that information. That's why you didn't see it. For next year, I believe we're not necessarily doing long-term evaluation, but so please look at the report for some of that data, and I believe the department will continue to look at the impact of PAD.
Okay. You mentioned that the majority of folks coming to the parks were from the surrounding communities, but a significant minority were not. Do you know who those people are? Where they're coming from?
So the survey is completely anonymous, so that people don't feel, that they are willing to participate in the survey. Other than the area they came from, we don't know much more about them. So we know their zip codes. Is there anything else we know?
So I can also say that there's a lot of people who are volunteers and youth employees, and those people may be going to parks that aren't their closest park, depending on how the park uses the staff.
So you would say probably overall it is a community.
It is. If you remember the map, most of the people that participated came from the surrounding communities, but then you see people from faraway places, and they could be coming with people who live in the area, they're visiting, and together they come to the park. Now, we think that's how PAD reached such a broad number of zip codes in the county.
there any other questions? Last question from the room?
Okay, unless there's any other question, we are going to end on time, and I want to thank our speakers and all the attendees online and in person. Thank you.
Now, let's see.